Welcome to COVID-19, Staying Safe and Helping Others with your Evergreen School District nurses.
If you're like me, wearing a face covering has been a hard adjustment to make. Most common reasons people don't like to wear face coverings are they make them hot, they fog up their glasses, it's difficult to breathe after a while, it's hard to talk or be understood. While these all may be true, wearing a face covering is still very important. When a face covering is worn by someone who is infected with the virus that causes COVID-19, it can help prevent the spread of infection to others. A face covering can help by blocking infectious droplets that spread when someone with the infection coughs, sneezes, breathes, or speaks. It's important to wear the face covering the correct way. Taking it on and off with the proper technique needs to be practiced as well to prevent the spread of germs. You may need to experiment with several different face coverings before you find one that you feel comfortable wearing for a length of time.
We've all seen advice from the CDC and other healthcare experts about wearing masks to slow the spread of COVID-19, but some people are still skeptical. Some of this confusion is due to the CDC's initial advice that only healthcare workers needed to wear masks. So why are we now saying everyone should wear a mask? First, it's important to note that part of protecting ourselves and others from COVID-19 is adapting to new information. The COVID-19 virus is not one that scientists have been able to study for many decades. As a result, we as a society are learning from scientists who are studying the virus in real time. When it comes to masks, the benefits have become increasingly clear, not so much to protect ourselves, but to proactively protect those around us. Scientists now know that people can spread the coronavirus before they have symptoms. That means none of us should assume we can't infect someone else just because we don't feel sick. We also know that the virus primarily stays in a person's lungs and throat. So the main way people pass along infections is from their mouth and nose, similar to other respiratory infections. Of course, an individual particle is very, very small, certainly small enough to pass through cloth. But the coronavirus almost never travels alone. COVID-19 mainly spreads by hitchhiking along with moisture that comes out of our mouths and noses. This can be an obvious thing, like when we cough or sneeze. A less obvious way is when we're talking and breathing. Even in these cases, our lungs are pumping out very small droplets of moisture that might contain virus. And we know that cloth masks work to capture these droplets. That's why experts are now confident in recommending that people wear a mask. Unlike the special N95 masks healthcare workers use around patients or in the laboratory, a cloth mask can be used repeatedly to catch these droplets from our mouths, even if it's homemade and even if you have to reuse it before cleaning it. We can use our knowledge of how the virus spreads to stop it. But we need everyone to work together for this strategy to work. Combined with social distancing, hand washing, and other measures, wearing a mask is a powerful tool to fight the virus.
Face shields are not a substitute for face masks, but rather should be worn in conjunction with masks when eye protection is needed. They should also be worn with neck protection to prevent droplets from escaping out. While the plexiglass provides an immediate barrier if someone coughs or sneezes toward it, the barrier does not replace the need to follow public health requirements such as the need to wear a face mask and follow proper hand hygiene practices. Even though a plexiglass may separate you from a coworker, You still need to wear a face covering while in the same room. The virus has no trouble going over the top of these plastic borders, so protect yourself and others by wearing your face covering when in public spaces. Whichever face covering you decide to wear, it's only effective if you use it correctly. Practice makes perfect. In the next video, Nurse Karen will show you how to properly put on a face covering.
I'm going to pick up your mask from the loops of the ears. Now my hands are clean because I just washed them, so make sure you wash your hands before you put your mask on. So you take the loops, you want to put the bottom part under your chin, top part above your nose, and the loops around your ears. Then you want to go ahead and pull this part up above your nose to the bridge. Now some of these masks, they have like a little metal piece in here, so you just want to squeeze on that on the bridge of your nose, and that'll hold a really tight seal, and it'll prevent your glasses from fogging up if you're wearing glasses. And then you pull the bottom part down underneath your chin. Then you got a perfect fit. And to take it off, you take the loops from behind the ears and you take it off. If it's a cloth mask like this, you just take it to your washing machine, throw it in on high and wash it, and then you're good to go for the next time. If it's disposable, you want to go ahead and disregard it. And that's about it. And don't forget to wash your hands after you're done. Hand hygiene is an important practice, especially when leaving or arriving, coughing, sneezing, blowing your nose, before preparing or eating food, after using the restroom, after being outdoors, after touching doorknobs, light switches, and other frequently touched surfaces. Along with mask wearing and social distancing, hand hygiene is the most powerful tool we have to prevent COVID-19 and infection in general. Today I'm going to show you how to effectively wash your hands. Let's come over here and turn the water on a little bit. Let's get a squirt of soap and let's start rubbing. It's the rubbing and the friction of the rubbing that gets the germs off your hands. And as many of you know, 20 seconds is the magic number. Happy birthday times 2. So you want to sing that along in your head while you're doing this. So at least 20 seconds of rubbing. Get the nails in there, because underneath the nails is a place germs love to live. Keep rubbing. Let's get our thumbs, each of our fingers, and now the other hand. Let's go in the webs in between the fingers, and let's get our wrists, and let's rub. And now we can rinse off. One hand at a time. That way you don't get any germs on your hands. Then, make sure you get all the soap off. You're going to grab a paper towel and you're going to dry your hands. After you dry your hands, you're going to throw that paper towel away. You're going to take another paper towel. You're going to come over and you're going to turn off the faucet and throw the paper towel away. And that's it. You have clean hands. Sometimes when we do not have access to soap or water, we can use hand sanitizer. Take a squirt of hand sanitizer and rub it all over your hands, including underneath your nails. You need to rub your hands for at least 20 seconds. Remember to wash your hands with soap and water once it is accessible to you.
Social distancing is imperative to help keep us all safe and limit the spread of COVID-19. But what does this really mean? Here in Santa Clara County, the current orders are keeping at a 6-foot distance from each other at all times whenever possible, when out in public with anyone outside your immediate household. This means inside the workplace or schools too. Even with face masks or face coverings on. we need to keep this 6-foot distance. It is not an either-or situation. What does this mean? First, these photos show how to not social distance. Please note the disclaimer about the photograph of Kieran and myself. This was taken prior to the restrictions being placed. What does 6 foot look like? Some good examples here are the length of a standard mattress or the width of a standard car. These are items that most people can visualize. Also, for all the teachers, 2 yardsticks laid end to end. Why do we need to keep our distance? COVID-19 is spread through air particles. Even just through talking, we could be spreading germs, and if we cough, sneeze or sing close to someone, then we can spread more. Wearing a face covering can minimize particle spreading, but they do not eliminate them. So by wearing a face covering and maintaining 6 foot distance at all times at the workplace helps protect you, your families and your co-workers. Here's a video now of an example of how quickly a sneeze can spread germs. Please do your part and practice social distancing at all times, at work and out in public, along with wearing your face coverings and practicing good hand hygiene. These 3 things are what will help keep our community safe. Thank you for your time, and if you have any questions or concerns, please contact your school nurse. Thank you.